couple special guests, and one is Dean Britigan, who many of you recognize, Dean of the College of Medicine, and my Dean, and formerly Dr. Steve Wengel's Dean, and also our CEO of the hospital, Dr. Jim Linder, and they're both here to just make some brief remarks, and then we'll kind of go from there. So, Dean Britigan.
Thank you, Aaron. Actually, the reason that Jim and I wanted to get together with you today is, as you're all aware, since the summer, actually even prior to that, we've been going through the search process for Steve's permanent successor. And Rod Markin led a search committee that scoured far and wide for potential candidates for the position. 4, as you know, were brought in for interviews last fall. As you know, communicated before, the search committee basically went through and then advanced a slate of candidates to me to seek additional input. Many of you were kind enough to either come talk to me or provide some email input to me back in November and December. And I was able to arrive at a decision in consultation with Dr. Linder and others, and I'm pleased to announce that effective today, we will be taking the interim title off of Dr. Liu's chair position, and provide that Howard will be now serving as the permanent chair of the Department of Psychiatry.
All right. Well, it's been a real pleasure. I have the benefit of I guess, being the 6th chairman is what Carl Greiner told me. The Department of Psychiatry. We started in the 1950s, as many as you know. How many of you were here when the Nebraska Psychiatric Institute was still a building? Raise your hands. So, the 2 of us. And there's, of course, still an eagle in the 4th floor of Pointer Hall, and Steve has retrieved some bricks. But really, we've got a strong legacy going back to the 1950s. We used to actually pioneer telehealth. It was really one of the first sites around the country. A lot of research went on, and there were some extensive clinical programs of all kinds there. And as we think about the future, I have a few people to thank. Of course, everyone here has done an outstanding job. Why don't you stand up if you're part of the leadership team as well? Why don't you stand up, and we'll recognize you. So please give me a round of applause for them. So well done. Thank you very much. Everyone who stood up has a big job. And really there's 3 things that Dean Britigan and Dr. Linder have asked us to do. One of them, as many of you know, is to build a new residency program that will really be a strong, freestanding program for adult psychiatrists starting in 2020. And Dr. Daniel G. and Dr. Marley Doyle, and many of you who served on the steering committee, really have put in a ton of work to submit that program information form. And we will hear back end of February as to the status of that, but I anticipate that if all goes smoothly, we'll have a program ready to start July 2020, which is really our big charge. Complementary to that, I know Dr. Ken Zuha, Debbie Pittock, and many others have really worked together, Lona Balsanova, on the addiction fellowship, and that's really one of a series of fellowships that we hope to bring a complement to the residency program. And so that was a huge undertaking, and we'll find out, I think, by early February. Is that right, Ken? So those are 2 of the big educational pieces. On the clinical side, we have a lot of ambulatory work that we're doing, a lot of inpatient as well, just a little bit. And I think that one of the charges is to improve access. And I know that Maggie, David, Rebecca, and many others have been leading these committees to think about access. So I know I've had a recent conversation with Corey Shaw to talk about how do we phase this out, and so he wants us to present to the committee that looks at these proposals. First, an ambulatory expansion, plan. Then to look at a medical psychiatric units, so-called MPU, which would help us to treat both medically complex and psychiatrically complex patients on the inpatient side. And the third is to explore psychiatric emergency services of some kind, or a PES, so that we can increase throughput through the ED and really help the whole system. And beyond that, of course, we're also looking at categorical psychiatry beds to expand beyond the ACU footprint. So I think we're looking at several models of that. So clinically, it's been a big undertaking. On the research end, I know Sunjo Huang and Britigan have really been putting their efforts together to create an infrastructure for us as we're thinking about really laying down an academic framework so that we have an anchor in every division that's going to be doing a sort of PI level work, and so really putting down that framework and growing that in the future in collaboration with neurosciences, Boys Town, many others who are also very much interested in our projects. So, one thing I do want to comment upon that I think everyone has worked hard on is the idea of culture. So culture has been very intentional, and I know that's something that with the engagement and quarterly pulse surveys we're looking at across the institution. And so we are looking at that. Many of you, saw that we gave out the Citizenship Awards on Saturday, and we hope to do that every year to recognize those who are every day going above and beyond. But also just to reflect upon those adjectives that we threw out after the first retreat to talk about, what do we want to become known as a department. So, innovation, we talked about collaboration, we talked about ambition, and we talked about being friendly, right? So those kind of things that I think we can define as we're thinking about the next few years. Beyond those pieces, I think we still have a duty, and some of us have gone the 500-mile trip and some have not yet. But thinking about rural Nebraska, we do train the workforce there. Urban underserved Nebraska, and basically working with the FQHCs, right? So Charles Drew, One World, and so on. I think that's going to be a core mission area for us as well. So really thinking about how do we make sure we meet those duties as a public institution, as a public psychiatry leader, and finally beyond all that too, what's going to guide us ahead. So there's a couple interesting speakers that have come through. One was Joan Reed, who came through. She's the Dean of Diversity and Inclusion over at Harvard. And when she spoke, I think about a year ago here, to a lot of the leaders here at Nebraska Medicine, UNMC, she really challenged us to think about not just culture, but inclusion. And so one thing she said was, force yourselves to be uncomfortable with the status quo. And I think that that's something that every day, no matter how we define it clinically, we define it in terms of relevance to our partners, we define it in terms of our inclusivity as a culture and as a department. That's something that I like us to struggle with, to be uncomfortable, so that we go from being a very solid department to one of the regional best in the Midwest. I think that's one piece. And then the other piece, which I like, which comes from the president of Pixar and Disney Animation, is this mantra to managers and leaders, which is that the job of a leader is not really to prevent risk, is to make it safe to take risks, right? So as we're thinking about in the future, my charge to you is to take those risks. If we're really uncomfortable with the status quo, how are we going to disrupt them? There's a lot of changes coming in healthcare. We can't anticipate all of them, but really we hope that you will be part of the leaders disrupting the next generation of really how do we access psychiatry care. How do we train the students that are going to serve across our state and hopefully also nationally? And then just really being a partner with so many communities across our state. So with that, I just want to thank you all. It's been a great privilege, and I look forward to working together. Thank you very much.
I'd just underscore that if you listen to the various opportunities that Howard has laid out, there's no shortage of things that this department can do to better the behavioral health situation in the state of Nebraska. There's tremendous needs, and it impacts every community. It impacts all aspects of the care we provide to our patients. And we're committed to working with you as a department, making sure we can better meet those needs, because it's clearly one of the greatest crises our society faces today. And we're fortunate that we have Howard's leadership, we have the great faculty and staff that are in the department to start tackling some of these problems in innovative ways. So, congratulations.
Thanks so much for your support, and I appreciate it.
So just to give you kind of a little bit of a insight in terms of kind of the steps around the announcement. So appropriately enough, we delayed the announcement so we could get all of you together, so you are the first to hear. Later on today, there'll be an email that's sent around to senior leadership at Nebraska Medicine, UNMC, and some of our other clinical partners, letting them know about the change. And then you can expect to see an article in UNMC Today and in the College of Medicine newsletter that should be coming out tomorrow. So until that time, you're clearly free to share the information, but it'll be broadly known across campus by tomorrow.
Thank you so
So,
much.
Howard, again,
Thank you.
congratulations.
Thank you very much.